you so much for having me here with you today. Please bear with me. I have a sinus infection, and I'm just about over it, but I do sound a little nasally, so I apologize for that. I'll do my best to get through today. So thank you so much for having us here today. My name is Tiffany. I've had the pleasure of speaking to you before. I'm always excited when I'm invited back. And I am the marketing manager for Bayada Home Healthcare. So today we're going to talk, we figured new year, let's start fresh. We've got some new residents here, and we're going to talk about understanding the benefits of home healthcare. So kind of a getting back to the basics as we're starting off this new year. Oh no. All right, all right, pause. So an introduction to Bayada Home Healthcare. So who are we? What do we do? Bayada was founded in 1975 by Mark Bayada. At the time, it was a privately owned company. We have since shifted to a nonprofit, but our headquarters still is located in Pensacola, New Jersey. Today, we have over 330 offices. We provide nurses, home health aides, therapists, social workers to over 50,000 clients per year in 23 states. So we are one of the few national providers that offers a full range of home and community-based services. So Mark Bayada's vision was, if we leave a lasting legacy, we can serve, to leave a lasting legacy, we have to serve millions of people. So we truly are a company that believes in our vision, and we are a values-driven company. So oftentimes you'll hear us talk about compassion, excellence, and reliability. And when I was actually going through the process to be hired for Bayada, before I could even be interviewed, I had to pick which words spoke to me and why I thought it was important to our mission. And that's really how we start our screening process. We want to make sure that the team that we're bringing on board at Bayada truly believes in our mission and our values. I'll tell you, for me, I chose reliability. I personally have had to use home health care in my own life with my grandparents, and knowing that our therapists were coming was incredibly important. Knowing our nurse was coming was so important. And so having that reliability, I feel, has always been the most important thing to me. If you don't show up, if you're not reliable, people aren't going to trust you. And once you lose trust, it's very difficult to gain that back. So a little bit about Bayada today. So as I had mentioned, we have over 330 local offices. We provide services, actually now it's more than 100,000 clients per year. In December of 2018, we shifted to become a nonprofit organization. So we did make that shift. We provide care in 22 states and 6 countries. Since 1975, we have served more than 1 million clients, which is pretty remarkable if you ask me. What I love about this company is David Bayada, who became our CEO, he started in an office just like any of us. He started as a client service manager, and then he became an office director. And then eventually he grew and he became the CEO, and he tells us about this journey that he had. And what I like about it is he's very humble, and he says, I was not a great office director, but I had to learn what the office goes through. And I think until you've walked in somebody's shoes, it's really hard to be a leader because you don't understand what that journey is like. And so when rules are being rolled out, or policies or changes, things like that, the company, we believe it and we buy into it because we know that our leaders have been in our shoes. They've sat at the desks that we sit at, and they've served clients the same way that we are. So why is home health care growing? We're going to skip that word. Technology is advancing, and people are living longer. So 24% of people over the age of 84 need some type of assistance with activities of daily living. Now, sometimes that means they just need interim assistance, and that's where home health care comes into play. Other times they need long-term assistance, and that's where we're looking at personal care, skilled nursing, that sort of thing. So what is home health care? It is a team effort, and I've talked to you a little bit before about that. So I'm one person. We have a huge office. Well, not a huge office. We have we have a team, rather. And then, of course, we have our therapists, our nurses, our medical social worker. There's absolutely no way one person could do the job that we do. Now, because we want it to be consistent for the residents that we serve, you get to see the same people day in and day out. We have the same therapists coming to visit you, the same nursing team coming to visit you. It's the same office team that you'll be speaking to, because again, it goes back to reliability, right? We want to be reliable. So we try to keep it as consistent as we can in the communities that we're working with. So Barb and Joe and Bill and Bryn, and I'm trying to think, I'm trying to think now of who our therapists and nurses are that are here. Chrissy, you've probably met a lot of our team at this point. All right, so skilled care, home health care. What it is it requires a physician order. So you can't just wake up one day and say, I think I need therapy, and Medicare says, okay, great, we're going to pay for it. You have to see your doctor, right? Your doctor has to write you an order for whether it's nursing services or therapy. It can be provided by a registered nurse, a licensed practical nurse, a physical therapist, occupational therapist, a speech language pathologist, and a medical social worker. The thing that I think a lot of people don't realize when we talk about speech therapy is it's beyond just having difficulty speaking. Let's say somebody's starting to forget things. That's cognitive therapy. That's something that our speech therapist would work on. Or maybe you're having trouble swallowing, things like that. That's something that our speech therapist would also work on. So home health care, it's intermittent. So it's not something that we can do for the rest of your life. What it is you are seen by a therapist or a nurse, typically 1 hour, maybe 45 minutes, depending on what your doctor orders. Most of the time, it's following a surgery or a hospitalization, but not always, and that's the important thing to remember. Our goal is to avoid hospitalization. So certainly if you're starting to have trouble with something, rather than waiting for a fall or waiting for something traumatic to happen, talk to your doctor about it sooner. Most often it's paid for by Medicare or whatever your primary insurance is, and it usually follows a Medicare model, so it must be prescribed by a physician. You have to be considered homebound. So what that means is if you say, well, I think I need some therapy, but I'm going to go out and play a round of golf today, you probably are not considered homebound. However, if you say, I think I need therapy, but I have to go out today, I have a doctor's appointment, you can still be considered homebound because you're allowed to go out for essential appointments, you just can't go dancing. So we really look closely at whether or not someone is considered homebound. It has to be reasonable and necessary. We can't just provide therapy for everyone, even though we would love to. We do have guidelines we have to follow. And like I said, it is skilled and intermittent. So it's short term, right? Average, I would say, about 60 days. But certainly it can be less or more depending on your needs. So the requirements, we've talked a little bit about this. We don't have to go into each one again. Teachable caregiver. So that's something that's really important. So the goal with home health care is to get you to a point where you no longer need us. A lot of times that means a transition into outpatient services, which happen in our therapy gym on the 3rd floor. This is the third floor, right? I always mess it up. Yes, the third floor. But if you have, let's say, a spouse or a caregiver that we can teach to help with certain things, or you have someone from the home care team coming in to meet with you, that's our goal as well, is to try to, if we have to teach a caregiver, we certainly can do that. It's rehabilitative and restorative in nature. So again, our goal is to get you well, whatever those goals look like. We had a woman recently in another community, and she said, my goal is to be able to walk down the aisle at my granddaughter's wedding. She said, I don't want to have to use my wheelchair, I want to walk. And that was a reasonable goal for her. And we worked and we worked and we got her walking down the aisle. Now, she did have support from her family, but that was her goal. And it's important for us to know what your goals are. So if you say, my goal is to play a round of golf, well then, darn it, we're going to work as hard as we can to get there. So that's where that conversation with the therapist will happen early on to say, what are your goals? What do you want to do at this time? We have some residents who say, I want to be able to stand up and not make a noise in pain when I do. That's a reasonable goal. Everybody has different goals, and it's important for us to know what they are. So who pays for home health care? So Medicare, it's covered in full, or managed care, so Blue Cross, Horizon and Aetna, those managed Medicare plans that some people choose to have. Again, this kind of really just goes through, again, what we have talked about. Medicaid can also pay for home health care and private insurance. It is skilled. So, let's say we're talking about somebody who needs assistance with, maybe you've had a fall, you've got a wound on your arm or something like that, and you need some services. So as long as it's considered skilled nursing, so it requires a nurse to bandage it, we can do it. If you just need a Band-Aid and some antibiotic ointment, Medicare's probably not going to cover it. But again, that's where our team gets involved and says, this is what we can do, this is what the plan is going to look like. And of course, we work with your physician to make that happen. So how do you obtain services? So you all should have seen the paperwork when you walked in. There are so many different criteria for whether or not somebody needs home health care. It can be that you've started a new medication. Maybe you were recently diagnosed with a condition. It can be that you feel like you're just slowing down. Maybe you've had a fall. Any of those reasons could prompt a call to our office. So our office line is there. Of course, you can always stop by and see our therapy gym on the third floor, and also talk to your wellness nurse. I know Tori is fairly new over here. She seems really, really wonderful. We're excited to work with her. Of course, you have Jackie available also, but talk to your wellness nurse, talk to your doctor about it. Any of those ways will get you to us, get your information to us, and if you see us out and about and you have specific questions, don't hesitate to stop us. Our therapists are usually wearing red of some sort. It's our company color, and so you can spot us in a crowd. All right, so you've selected a company. With everything, I do like to say, of course, while we are here providing services to you, you always have a choice of which home health care company you want to use. I think it's important to remember resident choice is more important than anything. Certainly, it's the convenience of having us here. We have good positive outcomes from a clinical standpoint, but you do have the choice should you decide to choose another company. So you've made a decision, you've decided who you want to be your home health care provider. So now what happens? You're probably going to receive a phone call from our office, and they're going to be saying, we're going to be coming out, our therapist, Joe, is going to be coming out to see you on this day and this window. First thing that we're going to do is an initial evaluation. So we have your health information from your doctor. We have your, well, in some instances, we have your list of medications, your insurance. The more information we can have, certainly the better when we're talking about a plan of care. But let's say all we have is your face sheet and your physician order. When we sit down with you to do the evaluation, we're going to be asking, tell me about your past medical history, surgeries that you've had, medications that you take. What does a typical day look like for you? What are you concerned about? We need to do an entire background. We call that the client assessment or the evaluation. We're also going to be observing your space for safety. You know, oftentimes we think, well, I've had a fall in my apartment, something must be wrong with me physically, and then we look around and we realize that we can actually make some recommendations in your apartment to make it a safer layout, whether it's removing an area rug that you keep tripping over, or maybe it's shifting your furniture around to open your doorways a little or open your walkways a little bit more. So we will be doing a safety assessment as well. You're going to have to sign a consent, right? It's just like going to the doctors. You've got to sign. I don't even know what I sign when I go to the doctor. I don't know about all of you, but it's just sign here and here and here. And at the end of it, you've signed your name 14 times and you don't have any clue what you've just signed away. So you've got to sign a consent. And then we're going to talk about your rights and responsibilities as a patient. So we're going to be working with you and your physician, and it is a team. You are a big part of that team. Your family, if you want them involved, is a big part of your team. So it takes a lot of communication on how things are going. If we have, let's say we have someone who maybe is having some swelling in their legs, and our nurse says, well, after lunch you should come back to your room and elevate your legs. Well, we hope you're going to do that so that together we can work on this plan to get you well again. So you do have responsibilities as a patient under the services as well. And then we're going to take all of that information, we're going to put it into a tablet, and it's going to create a beautiful plan of care. And anyone at any time on the Bayada team can look at that plan of care and say, well, Mrs. Smith, I know you're getting therapy this many times this week. I know who's going to see you. I know what your goals are. And that's the plan. That's the purpose of that plan. Of course, it should be the same consistent team working with you, but we all know in this day and age, you know, unfortunately things happen. Somebody has to take off of work, whether it's a kid at home on virtual learning or, gosh forbid, an exposure. So any therapist should be able to look at that plan of care and be able to pick up right where the other person left off. And then, of course, your team is assigned. So whomever has done your evaluation says, all right, I think this gentleman is going to need therapy from our occupational therapist, our speech therapist, our nurse, and it's blasted out to our team and the assignments are made. Okay, so why home health care? A lot of people say, I hear this often, well, I don't want to work with a therapist in my apartment. I want to get to the gym. I want to start using the equipment. I want to get better faster. That's often the thought process. What I like to say, and this is how you think about it, you can't run before you walk, right? You've got to start walking. And so when somebody says, okay, I'm going to start with home health care before I get to that outpatient benefit, we're going to get you stronger, get your endurance up, get you recovering faster so that when we get you to the gym to do the outpatient therapy services, you've already got a leg up, you're already ahead of the game. So certainly it's faster release from the hospital when somebody's signing on to home health care. It can be an alternative to nursing home or rehab center, and ultimately, that's going to depend on your diagnosis and what your doctor recommends. It is in terms of preventative, so keeping you strong, keeps you well, keeps you out of the hospital. However, if you do have a hospitalization, I would advise you to work with your team of nurses, doctors, social workers. They'll make the best recommendation as to whether or not a rehab center is the most, is going to be the best for you. So you get to have involvement in your treatment. Like I said, this is a team. We want to know what your goals are, what your objectives are. Our goal is to get you back to being as independent as you safely can be. It's comfortable. You get to be in your own space. You get to maneuver around your own apartment. I think that having the opportunity to work with a therapist to get in and out of your own car versus a model of a car or sitting in a chair, it's going to help you with some real life, what's the word I'm looking for? Muscle memory to get you moving and have you doing those things well. We encourage you to have your family involved if that's your choice. And if it's not, that's okay too. You have a greater sense of well-being and a faster recovery. So, we've talked a little bit about that. So oftentimes if somebody has been in the hospital, they've gone to rehab, and now they're returning to their apartment, what we found is that those folks that immediately sign on to home health care and don't have a delay, they're far less likely to end up back in the hospital, starting that cycle all over again. All right, so we can't talk about this enough. Home health care is a team effort, and communication is key, and that's important for us. And if at any point you feel like we're not communicating effectively or someone from our team is not communicating effectively, we encourage you to come and talk to us about that. I often have to think about perception is reality, and the way that I like to be communicated with isn't necessarily the way others like to be communicated with. I will tell you, my brother, when I'm giving him a task, when we were younger and we were given tasks, I want to be told what I have to do. Well, my brother is a list maker, and he wants to check the boxes. So for him, he wants a list he can work off of, and he'll check those boxes. For me, I like to fly by the seat of my pants and live in the moment. So lists are not for me. So each person likes communication in a different way, and it's important for us to understand that. All right, outpatient services. So the thing that everybody knows about or should know about. There is a copay with outpatient services. So I think with Medicare, it's usually they cover 80%, there's a 20% copay. It does happen in the gym space on the third floor. It can be physical therapy, occupational therapy, and speech therapy. Still the same thing. Therapy must be medically necessary, and the patient may or may not be homebound. So, I think it's important when we're looking at somebody who needs therapy for the first time that we're really looking at how can we maximize your benefit? How can we get you the most coverage for the insurance that you have? And so typically if you are considered homebound, it's getting you a few sessions in your apartment and then transitioning you to the outpatient gym. I say we pay so much into Social Security and health insurance and all of those things, and we should utilize those benefits to take full advantage to make sure that we're staying well and staying healthy. I will tell you that in our gym currently, we only accept Medicare as the primary insurance. But if we don't accept your insurance for some reason, we certainly would be able to help with finding an outpatient gym that would. Outpatient services can take place in your apartment, but most often they'll take place in the gym, or like I said, if we're working on car transfer, we'll go outside, or if it's just it's a beautiful day and you want to take a walk, we'll do that also. Okay, so who pays for outpatient care? So 80% Medicare approved. If you have a supplemental insurance, a lot of people will say, well, Medicare is my primary, but Blue Cross Blue Shield is my supplemental. Most often, they will cover that 20% copay. We never provide services before we have a conversation with you about what's covered and what is not. So you're not going to receive a surprise bill from us a month after services have started. We're going to discuss all of that with you ahead of time. All right, so that's it. That's what I've got. Any general questions without, I say general because a lot of times when I'm asked a question about benefits, I like to ask a lot of follow-up personal questions to try to understand. And so I try to avoid asking too many personal questions for your protected health information. But any general questions for me? Yes.
For the 20% that Medicare does not pay, do you provide the paperwork for the supplemental, or is that up to us?
No, so the question is, just for anyone that couldn't hear, if Medicare only covers the 80% and then there's that 20% copay through the supplemental, we take care of that billing as well. So the only thing that we ask from you is copies of your insurance cards, front and back, which oftentimes we get from the wellness center, honestly. And then, we bill accordingly. Good question. All right, well, that is all that I have. Who's turned in a survey so far? Wonderful. That's great. I love that. Because we love coming here, but, do you have a question?
I do.
Okay.
We have a Blue Cross managed care, so we are not eligible at the therapy here. But we are eligible going out in the community to one of the other PTs. What about all these other services and their relationship to a Medicare Advantage plan and just Medicare?
When you say other services, do you mean the inpatient services? So like, let's say you've had a hospitalization at that point, are you asking?
No, just wear and tear old age services.
Okay. Well, we currently, I mean, the only thing that's not covered by us, as far as your insurance is considered, is the outpatient services. But if somebody needs, if let's say your situation changes at some point and you need therapy, we certainly would look at that to see if it is covered. Now, I don't know what each specific plan is covered, or what each specific plan covers, rather. But for us, we just can't accept it on an outpatient basis, but we could on an inpatient. I don't think that answered your question, but I didn't.
It's very, like, I don't know what marketing says to people coming here, that, we have this wonderful PT center, but if they have managed care, they're not going to be, Medicare Advantage, they can't use it.
Mm-hmm.
So, I mean, we have to be clear in what we're telling, but also, I've had to use outpatient therapy a lot, and I'm into another, 2-month drill. So I will be carting my body here and there. But I am independent, and there's a big missing hole here for a lot of our residents.
Yeah. Unfortunately, we have heard that, and I know even when Brookdale was the therapy provider, there were insurance that they didn't accept as well. I think the thing to remember is each time a person needs therapy, it's considered a new episode. There's new circumstances to consider. So while a person may not have qualified for inpatient or homebound status therapy once, it doesn't mean that that's always going to be the case. And so, our therapists are really great at looking at each situation and each person individually to say, will this person qualify? As I had mentioned, you can be considered homebound, but still go out to the doctor, still go out for necessary appointments. But, certainly if you are running around the halls and you're playing golf or you're dancing, well, it's very hard for us to look at someone and say, yes, they're considered homebound. And we always have to follow the Medicare guidelines or the federal guidelines as far as that's concerned. But, what I would suggest is don't get discouraged if you have a managed care. So if something does happen to you, still talk to your wellness nurse. Let us have the opportunity to talk to you, because even if you didn't qualify once, it doesn't mean that's always going to be the case.
What is the exact reason that Medicare Advantage plans are not accepted?
Unfortunately, we're just not covered with, we're just not contracted with them at this time for outpatient services.
But
I don't have an answer to that, and I wish I did. Insurance companies are complicated, and I don't know. And I will tell you that it's not just us. Oftentimes in communities like this, where there is a gym, it's the same circumstance. And so I don't have an answer, and I'm sorry that I don't have an answer for you. I understand that it must be frustrating. But like I said, certainly don't get discouraged. If you do need therapy, even if once we couldn't help you, it doesn't mean that we won't always be able to. All right, yes.
I've had therapy in my one period from not only from the which I was at the other before they were I think I did not go to the therapy because it was closed. Okay, now there's a change. I was able to get the results and get a job. Then I had changes in my legs, and I had permanent injuries in my back, so therefore I couldn't stress on that, but made sure it was done. So I stopped doing that. Now, if I never gentleman before took me back, and said I would give it period of strength, and then it would be extended. But he would be able to tell me because he would have to get my situation. Okay, now hearing all this now, I feel that I can't be answering, I put that, so there's a change in the now I decided that the first is not like, how do I feel? You've actually first in this year, and I'd like to get you there, I don't know who's respecting.
So what I would suggest if, and her question for anyone that can hear is she's had therapy services before and now she's thinking she may need them again. And so what I would suggest is talking to your physician, talking to the wellness nurse about it, explaining to them what's going on, why you think you may need some services. They'll make a referral to our team. Our team will review all of the information and determine if you would benefit more from therapy in your apartment initially or going to the therapy gym. So we make that recommendation based on your health history, what's going on, all of that. So my suggestion would be to start with the nurse and start with your physician, and then, certainly we'll take it from there. Perfect. Yep, yeah. And you just let them know, and then they send over the information. So just a little behind the scenes, what happens is our team has regular meetings with the team here, the nursing team here. So we do meet with them. We talk about anyone that could be at risk. Our goal is always to be proactive, and not just Bayada's goal, but the team here at Freedom Village. They want you to stay well, and they want you to stay healthy. And so our goal is to always be proactive. A lot of times, I know I've experienced this with my own dad. He lets his pride get in the way, and he says, I'm fine. And then something happens, and he wasn't fine. And I attribute that to his stubbornness. I think I inherited a little bit of it myself. But if you notice something is changing in your health or you're not feeling well, definitely let your doctor know right away. Let the nurse know right away, because when somebody has to have a hospitalization and then a rehab stay, it's a lot to recover mentally, physically, emotionally. I mean, it's a roller coaster, right? And so our goal always is to try to avoid that and keep you well and keep you here in your apartment. All right, well, that is all that I have. So we are going to be reviewing the surveys that have been submitted. As always, we want you to have input in what we do here. We want it to be topics that you're interested in learning more about. I know that for next month, it is National Heart Month, so we are going to be talking about heart health. It's the theme, it's red, it's Bayada, it's our whole spiel. Yes. So we'll be talking about heart health. And then, after that, certainly we're going to look at those surveys. And also, if you have any suggestions on any fun things that we can do with all of you, as I had mentioned, we don't always want it to be clinical and sitting here listening to me lecture. We want it to be enjoyable. We did the holiday open house, which was so much fun. We had the opportunity to get to know some of you a little bit better. So if you have a suggestion of something that we could sponsor or support that would be a fun program to do here, we certainly would be interested in doing that as well. I'm a big fan of old-time movies and music, so anything that involves either of those things, I'm all here for it. Before we wrap up, I'll just leave you with this. I last night, so Turner Classic Movies, they show movies in theater occasionally. They come back, and apparently Casablanca, it's their 80th anniversary. I'm embarrassed to admit I've never seen the movie before, so I went to the theater last night to see it. And I walked out of there, and I think I must have aged myself at least 50 years, because I said, well, they don't make movies like that anymore, do they? And I did. I really, really enjoyed it, and I loved the music. And I've been fortunate enough, I should say, to work with seniors since I was 18 years old. This is all I've ever known. And so I've fallen in love with that music and, all of that. And so I cried a little bit. I laughed. It was something. So, if there's anything fun that you have as a suggestion, we're certainly open to that also. All right. Well, thanks, folks. Have a great day. I'll be here if you have any last questions for me.